Welcome back, everyone. Dr. Ford here. Today, I want to talk to you about a popular term being used all over social media, that being Ozempic face. And I want to talk about some of the fact and fears that many people have. Many people are wondering, is Ozempic face real? Is it dangerous? Should I stop taking my GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Well, please allow me to break it down for you clearly. Ozempic face is not a disease, and it's also not a harmful side effect to your medication itself. It is actually just a non-medical term used to describe the facial volume loss and sagging that occurs during your rapid weight loss. As your body loses fat, it also loses facial fat, especially in your cheeks and your eyes. And that loss of fat volume in your face makes you look hollow, sagging, and even older, even when your health is improving. And this happens mainly because your weight loss occurs faster than your skin can actually adapt. Remember, these GLP-1 medications are very effective at reducing appetite and slowing digestion, so people will naturally eat less. And if the weight comes up very quickly, even without enough protein, your face often shows it first. And now it's very important to know that this could happen with any rapid weight loss, not just GLP-1 medications. And remember, a sustainable rate of weight loss typically is about 1 to 2 pounds per week. And losing weight faster than that will increase your risk of facial volume loss, even more muscle loss, hair shedding, fatigue, and of course, nutritional deficiencies. So obviously, a slower weight loss gives your skin and muscle more time and metabolism to adapt. The good news is there are ways to help reduce this risk, and there's a couple ways. Number one, protein intake is essential and non-negotiable. Your target protein intake should be about 1 to 1.2 grams per kilogram of body weight per day. Remember, protein preserves muscle. It supports skin structure and helps reduce overall volume loss. Second, micronutrients are important and very critical. Remember, you're eating less food, so therefore you're consuming less vitamins. And without proper supplementation, you will develop deficiencies. And some of these nutrients that you should be watching out for are like vitamin B12. And you can tell if you have some fatigue or brain fog or tingling. Or if you're feeling exhaustion or feeling leg extremity coldness or restless leg, you probably have some iron deficiencies. Remember, vitamin D and calcium is very important for your bone loss and bone loss risk. If you're feeling muscle cramps or eyelid twitching, you probably have some magnesium deficiency that you need to be supplementing. Now, remember, hydration is essential, very essential, because these GLP-1 medications, they actually do suppress your body's natural thirst centers in the brain. So you're actually going to not feel thirsty, but you are dehydrated. So you can't wait till you feel thirsty. And finally, remember, I know it's difficult, but resistance training is essential, about 2 to 3 times a week to help preserve lean muscle mass and protect your metabolism. Now, if your face changes, due to these occurrences, it's important to know your options. They do have some, topical skin cares to help improve hydration and skin quality, but it won't improve or restore your loss of volume. But there are some other cosmetic, things that you can do that will help restore some volume, like dermafillers. Well, that could be Juvederm or Restylane, or biostimulators like Sculpture or Radius. There are some non-surgical skin tightening options like radiofrequency devices or microneedling with PRP. And for more severe cases of skin laxity, you also have the surgical option of skin grafting or facelifts. Now, remember, these options are cosmetic; they're not medical, and they're used for like restoring the balance, but nothing to do with stopping the weight loss. So here's what I want you to know. Remember, Ozempic face is not dangerous, and it doesn't mean that your medication is harming you. Faster weight loss is not better. And most important, remember, protein, nutrition, and strength training matter. And these GLP-1 medications are very incredibly effective at a proper indication. And with proper education and medical guidance, you'll be in good hands. Now, until next time, stay informed and stay healthy. And I'm here, Dr. Ford.